In this short video, I will be talking about Duchenne muscular dystrophy, or DMD, and the effects of this disease on a child experience in a school setting. DMD is a severe form of muscular dystrophy that mainly affects males. It is characterized by a loss of dystrophin, which is a protein that acts as an anchor, linking the intracellular actin network to the extracellular matrix by binding to a complex of proteins on the sarcolemma membrane called the dystrophin glycoprotein complex. Without dystrophin, the entire complex is absent from the sarcolemma membrane. Loss of this complex leads to a decrease in membrane integrity and increased leakage of certain molecules from the muscle cell, causing contraction-induced injury to the cell over time. This progressive damage sets off a series of inflammatory pathways in order to compensate for the repeated muscle injury, and this inflammation gradually leads to fibrosis as the patient's muscle function steadily declines. By the age of 4 or 5, boys with DMD are already experiencing some muscle weakness and are having a harder time playing sports or performing physical activities than other boys their age. That is why it is very important to ensure that younger boys with DMD are able to go to school, participate in activities with their classmates, and not be put at a disadvantage by a lack of accommodations from the school system. A study done in Scotland emphasizes the importance of supporting those with a disability and making sure that they feel included by their peers. Participation in physical activities has been shown to improve mental health and quality of life. However, special circumstances need to be considered so that students with DMD do not risk further damage to their muscles. There are 3 types of muscle contractions: isometric, where there is no change in muscle length; concentric, where there is a decrease in muscle length; and eccentric, where there is an increase in muscle length. DMD patients should avoid eccentric contractions, since this type of contraction makes the muscle more prone to damage. Performing squats, push-ups, pull-ups, walking down the stairs, and lifting weights are all examples of eccentric muscle contraction. However, this doesn't mean that boys with DMD cannot participate in physical education with the rest of their classmates. A DMD patient can still act as coach, referee, or timekeeper to feel included in the activity and gain an understanding of that particular sport. Also, PE teachers can incorporate certain types of exercises, like hamstring or heel cord stretches, as a warm-up activity and something that a boy with DMD can actively participate in. In addition, a study in Turkey found that a boy with DMD who participated in swimming after school experienced both physical and mental health benefits. Swimming is less demanding than other activities because it doesn't overload the muscles and actually helps reduce the stress on joints. Also, it allows those with muscular dystrophy to strengthen their muscles without putting extra pressure on them. For this reason, boys with DMD are often advised by their doctors to try swimming as a way to stay fit and improve their motor skills. On top of that, joining a swim club at school would increase a DMD patient's socialization with their peers, allowing them to feel like they are capable of doing the same things as other kids their age. This would help increase their self-confidence and their sense of self-worth. Aside from physical activities, educators can take extra steps to make sure that these boys can go about their day at school without risking injury. For example, an extra set of textbooks should be available in each classroom so that they don't have to carry heavy books from one class to another. Schools with multiple stories should have elevators that are close to these boys' classrooms so they are able to go from one level to another smoothly. If these children get tired during the day, they could use a wheelchair or a power scooter to get from one place to another, which is why the school should install ramps and make sure that their desks or cafeteria tables can fit wheelchairs. Also, when planning a field trip, schools should take into consideration the destination they choose. If the trip involves a lot of walking, a wheelchair can be used by these boys, and a bus with a wheelchair lift should be used for transportation. Having DMD shouldn't prevent a young boy from going to school and engaging in social activities. There are many ways for these boys to feel included, and educators should take any steps necessary in order to accommodate these children and allow them to have a normal school experience. A physical therapist could help determine what activities these boys can participate in and how to make their school day go smoothly. Parents can have regular meetings with teachers to make sure that their child is being supported while staying safe. Taking these extra measures would allow boys with DMD to form meaningful friendships and stay involved with the community. Ultimately, more education about this disease can help teachers have a better understanding and raise awareness about DMD patients' capabilities and needs to ensure their greatest chance at success in school. Thank you for watching, and I hope this video gave you a new perspective on DMD.